It truly is a miracle that babies are born without any health issues. There are so many defects, illnesses, and mutations that can go on during fetal development. According to the Spina Bifida Association, every day about 8 babies in the United States are born with spina bifida or a similar birth defect of the brain and spinal cord. That's almost 3,000 babies a year alone. But there are ways that you can detect it and how to treat it. But first, what is spina bifida? Spina bifida is a birth defect in which the vertebral column does not close all the way. There are actually 3 types of spina bifida. There's spina bifida occulta, meningocele, and myelomeningocele. Spina bifida occulta is a mild and most common form of spina bifida. It's caused by the small part of the vertebral column not closing properly, but normally people can still function with it and the spinal cord can grow properly. People can go their entire lives without knowing it, or if they get an x-ray done, that's the way they find out that they have it. But there are some possible neurological problems, such as a tethered spinal cord. The second one is meningocele. It's the rare form of spina bifida. The meninges of the spinal cord push out through the opening of the vertebral column. And what the meninges are, it's this membrane that surrounds the spinal cord and the brain to protect it. You can have surgery to remove the meninges and carry on throughout life without any other problems. Myelomeningocele is also known as spina bifida cystica, or more commonly as just spina bifida. It is the most severe type of spina bifida. About 1 in every 1,000 babies are born with this type. What happens is the vertebral column and the neural tube do not fully develop. Neural tube, what it's supposed to do is eventually develop into bones. And when that doesn't happen, the meninges and the spinal cord end up pushing through that vertebral column and it forms a huge bulge on the baby's back. For example, in this photo here. And that can lead to partial or complete paralysis of the back and the lower limbs. It can lead to numbness, it can lead to pain, and it can also lead to uncontrollable bowel movements. People with this type of spina bifida end up having crutches, stents, or other type of walking devices, or even end up in a wheelchair for the rest of their lives. And most tend to have hydrocephalus also, which means an excess buildup of cerebrospinal fluid, which encases the brain and the spinal cord. And when that happens, it causes a lot of pressure and the swelling of the brain, which ends up leading to learning disabilities. Now that you know what it is, what causes it? It's not 100% understood what causes it, but many believe that a family history increases the chances of getting it. According to the Mayo Clinic, it's more common among white and Hispanic people, and is most common and girls tend to be more affected. The environment in which the baby grows in and the nutrition that the mother takes in is also very important. Folate or folic acid, specifically vitamin B9, is necessary to have in the diet to help the baby develop properly. The lack of folate leads to spina bifida and other defects such as congenital heart defects. The mother being obese or diabetic also tend to run a higher risk of having a child with spina bifida. But how do you detect it? Normally you'll end up having pain in your lower limbs or your lower back, weakness or numb feeling, and possible deformations of the lower limbs or back. Sometimes there will be a small birthmark or a discoloration of the skin, a dimple, or a small tuft of hair that denotes usually where the spot of the defect is. You can get an x-ray done, which also shows it. And there's also the alpha-fetoprotein, or AFP, blood test, which is given at about 16 to 18 weeks of gestation. Now, alpha-fetoprotein is important for development. Too much or too little can lead to spina bifida. Most mothers tend to get ultrasounds, which also help depict how the spinal cord is developing. and then amniocentesis, where they inject a needle to pull out some of the amniotic fluid that surrounds the baby and test for the proteins that are around the baby. Now, how do you treat it? Most of the time it's surgery. There is prenatal surgery, which is about 26 weeks of gestation, where they go in and they do surgery, perform surgery on the child. This tends to lead to less severe developments, but there are issues with it. Mothers can end up going into premature labor or have a bunch of complications that go along with it. Another surgery is about 24 to 48 hours after birth. And once the surgery is done, they tend to do exercises with children to practice strengthening their legs for whenever they have crutches or stents. Because most of the time, anybody with spina bifida occulta or spina bifida cystica, they end up having crutches. Further surgery may be done whenever they get older due to a tethered spinal cord. Tethering means that after surgery, the spinal cord still grows attached to the scar and it causes some complications. So knowing what it is, how to detect it, and how to treat it could end up helping you prevent it in the long run. A little bit of research can make a big difference. Miracles happen every day, and a healthy baby is one of them. Thank you.